This video is for lash lift and brow lamination. So we always start with how we arrive at work, and the first thing that we would do upon arrival is wash our hands. So we're going to go to the sink, we're going to wet our hands, and we're going to get that coin-sized amount of liquid hand soap, and we're going to wash our hands down to our wrists. We're going to wash the back of our hands down to our wrists. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and nails. We're going to wash between our fingers. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists, and we're going to do all of that interlocking washing for a minimum of 20 to 30 seconds, and then we would give it a thorough and proper rinse underneath the water. When everything is rinsed off, we will grab some disposable paper towels or a clean towel, turn off the faucet. We're going to dry our hands completely. Toss the paper towels in the trash if we use paper towels. If it's a towel, it's now dirty and it's going to go into the closed container until time for laundry. Then we're going to grab our 70% ethyl alcohol, and we are going to go ahead and sanitize everything up before we prepare our room for our client that's coming in for her lash lift and brow lamination. So we are going to start by getting that room and tray ready. And we always are going to do this as much as we possibly can to prepare ahead of time for a client's arrival, because we want to be punctual with our appointment time, our schedule. We want to be respectful of their schedule and our schedule. So anything that we can do before the client arrives is critical in maintaining that work environment and that schedule, so you are of the utmost professional. So that means preparing everything before they get here. So we're going to disinfect our workstation, our bed, and equipment using a disinfectant wipe following manufacturer's instructions. We'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We will dispense products needed for the service. And how we'll do that is we'll prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or we can remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We're going to drape our facial bed using one fitted sheet, one flat sheet, and 3 towels. We will place clean, laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We'll lay a hairnet and a headband on top of the first towel along with a roll towel to support the head and neck of the client, and we'll save the third towel to lay across the client décolleté. You can also use disposable table paper to drape the bed, but we've done the fitted sheet, flat sheet, etc. So just to have you review my tray, I'm going to show you what I've got on there for my client already set up. So I've got, I always have some water, and of course I have my cotton rounds, and I have 2x2s and 4 squares. Disposable gloves, because you wear gloves for this service. I have like a barrier cream, it would be like a Vaseline or something, and the disposable under eye pads. I've got wooden stick Q-tips. I have the brushes that I'm going to use to apply my lifting and setting lotions. Makeup remover, lifting lotion, setting lotion, and then this is for the brow lamination. This is the wax part at the end. I have my rods that I will need for my lash lift, and the little tool to help the bonding agent adhere the lashes to the rod, the little tool that does that. I have some larger rods if I need them, so different sizes. I've got disposable mascara wands. I have these little microfiber brushes that we're going to use for the brow lamination, my Y comb for the brow lamination, of course my brow. All the things I need are already on my tray, and then a few little extra things. So that being said, the next thing that would happen would be the client consultation. I do have to get one other thing out that would not be necessary or on my tray. I'm just going to get it out to help me with the mannequin in the lash lift, and I'm just going to have that available to me when I need to put it on the mannequin. That would not have anything to do with a typical lash lift or brow lamination. It's just something to help me make the video happen. So we're not even going to talk about that. And after you prepare your room and follow all the steps that we read through, the next logical thing that you're going to do is greet your client when they arrive and do that client consultation, which is so important. One thing to note before we do that is we will always approach our client with clean hands. Sorry, something in my eye. Dust. Who knows what? Hair. And I will be cleaning my hands again before service, just so you know. Pardon me. I think I'm okay. Hopefully. And I'm going to get a sip of water. And I would be approaching my client right now with clean hands. I just want to review that step, of course, before we go through the steps of the client consultation. Pardon me for my eye. It's allergies for me bad this time right now. It's very cold out and it's change of season, and so excuse me. My eyes, my nose, all of the things. Just thought I might have to sneeze, but I didn't have to sneeze. Okay, so we will review what happens at the client consultation, once again noting that we have clean hands. And with this particular client that's coming in, because she's having a lash lift and a brow lamination, she would be notified even ahead of time of some important things to note with the service. Like, for example, you can't wet your eyelashes for 48 hours or wear makeup post-service if you want the service to last. So there's all kinds of things that would be communicated before they even come in that they would know about, that she would once again reiterate during the client consultation and then again at the end of the service. So just to make sure they have all those details and they feel really comfortable with everything they need to know. So you're going to greet the client and escort the client to the work area. You're going to assess the client's current style and determine the client's preferences. You'll assess the client's needs. You will assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours, and you'll consult on any known allergies. You'll consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above contraindications, you can move forward. And you really do want to take a minute there because it's so important to make sure that as an esthetician and a skincare professional, that you're not going to put your client in any kind of harm's way, meaning nothing that would hurt the skin or hurt the client's eyes or brow area, to the best of your professional knowledge. So you're really going to make sure you have everything answered that you need to have answered before you move forward with the service. So just taking that extra time and those precautions to make sure that they are the right fit for these services and that everything is okay. So it is. And you're going to help the client get comfortable so you can escort them into the facial room. They do not need to disrobe for this service. So you'll get them comfortable on the bed, and then you, of course, have your rolled towel that you're going to place underneath the head. You have, of course, your hairnet, which you are going to place on their head as well to keep the hair away from the brows and the lashes. You could use a headband, whatever works. And then I have that extra towel that I'm just going to cover up her décolleté up to the chin. It would be clothing. I just want to make sure she's comfortable, but make sure that nothing could get on her in any way for this. So she's fully good to go here. And then before I start the service, at this point, it would be time for me to wash my hands again. So I would go back to the sink, wet my hands, find that coin-size amount of liquid hand soap, wash my hands down to my wrist, wash the back of my hands down to my wrist, wash my fingers, and wash the backs of my fingers. I would wash between my fingers and my thumbs. I'd wash my fingertips and nails. I'd be washing my thumbs and wrists. And I would do all of that interlocking washing for a minimum of 20 to 30 seconds. When I feel like everything's good and clean, thoroughly rinse underneath the water. When I've had that proper rinse, grab disposable paper towels or a clean towel, turn off the faucet with the towels, dry my hands off. Paper towels go in the trash. A clean towel is now dirty. It would go in a closed container until time for laundry. Grab my 70% ethyl alcohol hand sanitizer. Sanitize my hands. Make sure everything gets really dry because you've got to put your gloves on. And the last thing that you want to do is put gloves on wet hands. Putting on my gloves. And then what I'm going to do is the first thing, which is removing makeup on the eye and brow area. So I'm going to take a couple cotton rounds with makeup remover on them, and then I will rest them on the eyes while I work on the brow. And what you're doing is, maybe they don't have any makeup on, but if they do, you're removing traces of makeup, dirt, debris, oil, anything like that that might be on the brow area. And then the same thing for the eye. Any traces of makeup. And then I'm going to dry the area thoroughly. And one of the reasons I'm going to do that is, A, you don't want any of this to be damp, but I have to do something for the mannequin that I would not have to do for the client. But even for the client, I would be drying it if it was wet. And I need to get these rods to adhere to my mannequin so that I can perform this lash lift. So what I'm going to do is try to use like double-sided tape on the lid. It's been working, so I'm hoping that it will continue to work. So what I'm going to do right now is just put that on. You would not be doing this ever on a human client. This is just my solution to the mannequin getting the rod to adhere. Normally we use a little bit of that bonding glue, which I'll show you for that the lashes that help the lashes stick to the rod, and that's what you put on your client. A couple little drops of that, and then the rod will stick to the lid until it comes off with water for the client. But this is my solution, and it would not be ever done on a client, just for a temporary solution for us to be able to use a mannequin. So just ignore this step. And now we can move forward. So what we're going to do is let me just make sure some of these lashes are trying to stick to my double-sided tape, and I don't want them to do that. I want my double-sided tape to stick to the mannequin's eyelid first. Okay, yeah. So what we're going to do is we're going to protect. So we're going to put a little bit of that barrier cream that I showed you underneath the eye, and that will help hold those eye pads on. We will be completely covering up the lower lash line and lashes. So first thing I'm going to do is put some of this barrier cream down before I put that eye pad on. It's going to help that eye pad stay on. It's also just the barrier cream just helps protect the eye area while we're working around it. Also going to put a teensy bit under the brow, just a little bit. And then we're going to put our eye pads on. Once again, they are going to be covering up the lower lash line. So you want to get it as close as you possibly can. Good. And then now we are going to attempt to stick the rod to my mannequin's lid to this double-sided tape first. Oh, goodness gracious, this iPad. Okay, let me just do this. It's moving all around. Okay. All right, so I've got my rod and I've measured it, and then I'm going to take it and I'm going to try to get it as close to the lash line as possible. Normally what I would be placing underneath this rod is a little bit of the lash adhesive that helps the lashes adhere to the rod, and I'll show you that in 1 second. And then I would be pressing down for 5 to 10 seconds, and it would be this. Just to get that rod to adhere to your client's lid. So I'm treating this little double-sided tape like that. It kind of worked, so let's hope it works enough to get us through the video. Same thing, gonna hold it down for 5 to 10 seconds. Although normally we'd be using a little bit of this guy. That's kind of popping up a little. I'm hoping also as we adhere the lashes to the rod, that will help at least hold it down a little bit. So I'm going to start working on that. So we're going to be applying this lash lifting glue to the rod, and then I'm going to start adhering the lashes to that, hoping that it will work nicely as we move along. And I'll get my little tool to do that here. And one thing to note about this first step here, how you adhere the lashes to the rod are how they're going to lift. So when you take your time here to do this first step, you're going to make sure that you keep them separated, that you keep them lifting in the direction that you want them to, because once they're on the rod, when you put your lifting lotion and your setting lotion, all those things on it, that's how it's going to stay. So it may be a little tedious and time consuming, but this is where you want to make it count. So I'm going to take the time and the effort here to make sure it's not clumped together, that they're all facing the direction I want them to face, not sideways, all of those things as it dries and adheres to the rod, that it looks exactly how I want it to look when it lifts. And my mannequin has a little bit of a shorter lash, which is okay. There's even a section here where she doesn't really have any lashes, which could happen for a client too. Because our eyelashes fall out in different ways. And sometimes this is just takes time. So you just have to be meticulous and patient. And so I'm just doing exactly the same thing for the other eye. almost done, guys. Almost done. Just takes time. So once you feel like you've got those lashes on the rod, it would be time to move into the step that you're gonna add the lash lifting lotion. So I've got a brush here and I'm gonna do that, and I'm gonna start at the base of the lash. And one thing that you want to note is that you are gonna take the lifting lotion only up 3/4 of the way on the lashes. So you're gonna stop, leaving 1/4 of the lashes with no lifting lotion. Excuse me, and the reason for that is that's the thinnest or weakest part of the lashes, and you don't want to over process it or make it dehydrated or dry. It's going to flake off soon enough. You know, that's the part that is going to come off. So you really want to emphasize the root and then up to the 3/4 where you're applying the lifting lotion. And I'm always checking in with my client here because she might smell something here because you can smell it, and also asking her, is it comfortable? Because this is where I know when I get my lash lift, I definitely feel the tingling, and it's nothing I can't handle. It's not too bad, but you just always want to check in, make sure that client's okay. And then I'm going to go to the other side and do exactly the same thing. Base of the lash, working my way up 3/4 of the way. And then I'm going to cover up her eyes, gently give her a little private time. And then you would follow manufacturer's directions for this. So basically it's going to take about 5 to 10 minutes for this lash lift. So you want to keep it on that way, or that amount of time. And so for the sake of the video, we're going to pretend that that 5 to 10 minutes has elapsed. And so we're going to take this off, and we're going to take those cotton rounds off, and we're going to remove the lifting lotion. And I'm going to do it dry first, and then I'm going to do it damp. So I'm going to gently press up and out to remove the lifting lotion, just the initial bit with a dry cotton round. And then I'm going to do the other side, and then I'm going to go back in with a damp. And however, if it takes 3 passes or whatever you think to remove all of this, you want to get it off. So I'm starting dry, and then I'm going to go back in with damp. and remove the lifting lotion. And now we would be applying the setting lotion. And you're going to do exactly the same as you just did. With your setting lotion. And I'm going to cover those eyes again. And the setting lotion would be sitting for 5 minutes. So once again, for the sake of the video, we aren't going to sit here for 5 minutes, but we're going to pretend that that 5 minutes has elapsed. And so we'll remove this and these rounds, and I'm going to do the same. I'm going to do dry, damp, damp, or dry and damp. And if I need to do more than one damp, I'm going to do it. I'm just gently wiping up and away first with the dry cotton round, just removing some of that initial setting lotion or neutralizing lotion, and then I'm going to go back in with a damp to do the rest. And then when I come in with the damp, what you'll see is that some of the lashes may start to go ahead and lift up off the rod, because this is where you're going to be able to remove it all. It's just depends on how much wet water or moisture you have. So as you're wiping it away, don't be surprised if you see some of those lashes go ahead and come away from the rod. That's eventually what they're going to do here in just a minute. We're just wiping away that last bit of that setting lotion. And then we'll go back with some more water in just a minute to really remove the lashes from the rod. So it may take, 2 or 3 passes for you to feel like you've gotten the rest of this lifting lotion. And then I'm going to go ahead and go to the other side before I fully remove it from the rod. And then I'm going to take one of my wooden stick Q-tips going forward now to really get those with some water on it to get the rest of the lashes to come loose from the rod. And it just gives it, I'm just giving it a gentle pass. A lot of these have already come off. Just a few more that have not. And then some down on this end too. And then I'm going to remove both the rod and this disposable iPad because it's going to just go right in the trash. And then I'm going to stealthily, pretend like not in the video, remove the sticky stickers, which, you know, we would not be using in this service. So I'm just going to take those away. And then what seems to be working, I'm going to use a 4-square to remove some of this additional debris that's on the lashes that would not normally be on there because we are using different materials for a lash lift on our mannequins than we would on a real person, and it's sticking to the glue in the lashes. This seemed to work a little bit better yesterday, but it is not what you would ever have to do because none of this material would be globbing up like this. It's because we're not using real products, we're mocking it. So please pardon this cleanse of the lashes that I have to do that you do not have to do on any level that's sticking in her lashes. It's just like a combination of the cholesterol, I think, and the glue, the bonding agent. And it just pills up and it's everywhere. I'm going to comb through too here once I get all of this off of her face. With a mascara wand and try to get the last little remnants of it out, which I would want to comb her lashes anyway once I, of course, finish with the lash lift. But of course she's going to keep those eyes closed because we're going to go to brows next, but I'm going to go over here to the other eye and try to get the same bit off on that side. So I'm just removing these last few lashes from the rod before I remove the rod and the under eye pad, which will be tossed. It's a disposable. So rod, under eye pad. Rod you'll keep because you'll sanitize it or disinfect it rather, and then I'm going to take this these stickers off that you would not be using. And then I'm going to get a 4-square just to get this extra debris off of her lash that, once again, you would not be experiencing because we're using some things that you would not be using on a client to mock the lash lift. Much better. And then we will have her rest while we move forward to the brow lamination, which we've already prepared that area. We've already cleansed it. We've got that little bit of barrier cream underneath the brow, and we'll be ready to proceed. So what we're going to do for the brow lamination is a similar kind of process to what we did for the lash lift. The first thing that we're going to do is we're going to comb through the brow, And we're going to, once again, like we did with our lashes, we're going to comb it up and out with a bonding agent. So we've got our mock brow right here, just to lay here so you can see kind of a both side. I would have my Y comb. And the first thing I want to do for my brow is comb it. And I would be combing it in the direction that I want it to stay. And it may take a minute, obviously. And then as I go along, I'm going to be putting my bonding agent on and then taking my time to then comb it up and out so that it would stay spread out in the direction of the brow that I want it to be for the lamination. So I'm just taking my time here to add a little bit of the bond and comb and add a little bit of the bond in the comb until it is positioned in the direction that I want it to be. And I would do exactly the same thing on the other side. So I would be really meticulous here in making that effort to use my little Y comb so that I can comb it up and out. And then apply a little bit of bonder and comb it so that it can stay in place. And I would be working all the way with that little bit of bonder and then my Y comb to get it exactly how I want it to look, because when I put that herming lotion on here in a minute, how I put it is how it's gonna be. So taking that time to do it. It looks great. And then once that's done, it's okay for me to go into the brow and apply my what we call perming solution or waving solution. So I would take one of my little microfiber brushes, I'd get a little bit of that solution, and I would start and do exactly the same thing. So I'm going to start at the base of the brow and I'm going to comb it up 3/4 of the way, not to the very, very tip. I would go 3/4 of the way up with that solution. And just note that my brow solution is completely different than my lash lifting solution. Different ingredients, different potency. It has to be, because with the brow, it's going to go through to the skin. So just so you know, that's got to be a little bit different. And of course, I'm going to be doing it on both sides. Combing up and out. And I'm going to stop 3/4 of the way. Once again, just taking my time to do it, to get it starting at the root of the brow, getting it, following the way I've bonded it up and out with that application. And then as always, you're going to follow manufacturer's directions. So let's just talk about what they said for manufacturer's directions. Fine brow, this would stay on anywhere from 3 to 4 minutes. Maybe a fine tinted brow, 4 to 5 minutes, sorry. A natural healthy brow, it could stay on for 5 to 6 minutes. And then like a really coarse healthy brow, 6 to 7 minutes. We're gonna say that this is a this is a fine tinted brow. So that means it would stay on from 4 to 5 minutes. So we're gonna pretend, for sake of the video, that 4 to 5 minutes has gone by. So I'm gonna do the same thing here. I'm gonna start with a little bit of a dry wipe, and I'm gonna take it up and out to remove. And then I'm gonna go back with a damp to remove. And if you need to do it a couple passes, whatever you need to do for this brow is fine. And then you would be applying your neutralizing lotion. So I'm going to use another one of these little microfiber brushes with a neutralizing lotion, and I'm going to go up and out, just like I applied the waving or perming solution. And once again, like before, both sides. And then we would be following manufacturer's instructions. And for our very fine brow or that fine tinted brow, we would leave this on for 5 minutes. And if it's either the natural healthy or that coarse healthy, you could leave it on for 6 minutes. So we're in that fine tinted, we're gonna say 5 minutes, and we're gonna say, for the sake of the video, that the 5 minutes has elapsed. So we're gonna go ahead and wipe off our neutralizing lotion, and we're gonna do it dry first. And then we're gonna come in with a damp second. And however many passes, if you need to do it 2 or 3 times, whatever you need to do to get that last bit off. And then we have one more step with this gorgeous brow. We have a little bit of a wax, like a shine, that we're going to put on it. We're going to comb it up and out with a little microfiber brush and brow brush. We want it to look gorgeous, but we're going to leave it with that good, beautiful, proper shine on it. And it's going to stay in that position. But tomorrow you're going to need to rebrush those hairs again. So it's not like it's never going to move until it's time for the next service. So we're putting our wax on here to have that beautiful sheen in the brow. We will be needing to do this, to at least comb it with a brow brush again. So I'm just going to take what is my brow brush here, giving it a nice comb with that wax in it, making it look gorgeous so that I can take that after picture, because of course I took my before pictures, to finish out that brow lamination. And oh my goodness, you get to present to your client how gorgeous she looks with a lash lift and a brow lamination, and she is absolutely going to love it and be wowed. So the good news is she didn't have to disrobe for this service. So what you're going to want to do is you're going to want to just help her up. It may take her a minute with her eyes, you know, blink, blink, just because she's had that lash lift on. She's been closed for a while. And then you can remove your disposable gloves, throw them away, and then you would want to escort her out to that client waiting area, checkout area, so that you can review that maintenance and aftercare. And all of that's important, like we said, just making sure that she understands how to take care of both brows and lashes when she goes home, because these things are important. With this, they require, if you want the service to last, special things that you could do. You don't want to ruin it by jumping in the shower that day or putting makeup on it. So you want to make sure that she understands fully what is required in order for that service to last. And then we'll get her rebooked for that follow-up so she can maintain this look, which she loves, get her out the door, get her checked out. And then it's time for you to go back to your room because you have to get ready for your next client. So when you get back in that room, you've got to look for any single item any single-use items that have not been discarded already. You need to go ahead and throw them away. Then you're going to get all those dirty implements and you're going to put them in a closed container labeled to be disinfected. You'll go ahead and strip the bed of all the sheets, bedding, and towels, put that in a closed container until it's time to do laundry. Then you're going to locate a proper cleansing agent. You will read the manufacturer's directions, and then you're going to follow the manufacturer's directions for mixing and usage so that you can wipe down the workstation and area with the cleaning solution to remove debris. Then you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. You will read those manufacturer's directions, which means you need to put a pair of gloves on, again, disposable gloves, because you're going to need them. And then you follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment stored in a clean area separate from other implements, and then you can remove those gloves, throw them in the trash, and it's time for you to do that final hand wash before you set up and prep for your next client. So you will go to the sink, wet your hands, get that coin-sized amount of liquid hand soap, Go ahead and wash your hands together down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingernails and tips. You're going to wash your thumbs. You're going to wash your wrists, and you're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And then you're going to give everything a thorough, proper rinse underneath the water. When everything's been rinsed off, you can grab disposable paper towels or clean towel, turn the faucet off with the towels, dry your hands completely. The paper towels can go in the trash. The towel is now dirty, so it can go in the closed container with that other laundry until it's time to wash it. Find your hand sanitizer that has 70% ethyl alcohol, and you're going to sanitize those hands. And when you've done your thorough, proper hand sanitize, you can go ahead and set up for your next client. So that concludes the video for brow lamination and lash lift.